Hello and welcome. My name is Ayush Gharat, and I'm the founder of Ashwas, a social initiative to aid frontline health workers, and a member of Inflame Medical Magazine, a student-led medical magazine. On behalf of Inflame Medical Magazine, today I am going to be interviewing Dr. John Paul, a consultant of internal medicine at St. John's Medical College and Hospital, Bangalore, to talk about his experiences and learnings during the COVID-19 pandemic. So, thank you so much for sharing your time to be a part of this interview. Glad to have you.
Thank you, Ayush. Thank you. Thanks a lot. Thank you for the opportunity. I must say that. Yeah.
Great. So we'll jump right into it. Firstly, I would like I would really appreciate if you could describe briefly your experience during the past year as you and your team dealt with the effects of this COVID-19 pandemic.
Yeah, sure. So that is actually, I think, one breaker question that you have asked, because I can go on and on and on about what all we have had over the last 1.5 years. But to keep it short and sweet, I guess it all started, as we know, at least in India, in March 2020, rather February 4th week, maybe 3rd or 4th week. Now, that was the time when I was a consultant in emergency medicine, the Department of Emergency Medicine. And then I moved over to my department, that is the Department of Internal Medicine, sometime in the month of August 2020. So I have looked at COVID from the emergency point of view when I was treating, or I was attending to the patients who would come to the emergency services of John's. And then for a brief while, I was even in the ICU. So I looked at COVID from the ICU point of view as well. And then when I moved over to internal medicine, the Department of Internal Medicine, I was looking at COVID from the ward point of view and the intensive treatment unit. Intensive treatment unit is something that comes between the ward and the ICU. So over the last 1.5 years, my experience with respect to COVID has been in all the realms of COVID. That is from emergency to ward to ITU to even the ICU. And of course, the last point being the death or the recovery. So to sum it up, I think I can put it as the good, the bad, and the ugly. I think that would be the best way to sum up the experiences, both on the medical point of view, as well as a professional point of view, and the personal point of view as well. So the good points, or the good pointers, or the things that I have learned and probably I have taught people, or maybe people could have learned from the frontline workers like us. The first thing, of course, people have recovered out of COVID. I think that is the best thing that has happened, the good thing. Though we say that, there are many things which are still not known to us with respect to the COVID part of it. Though there is no effective treatment, vaccination is coming up, but then the strains are mutating. Yes, there are things like that. But there are people who have recovered and who are doing reasonably well when compared to what it was pre-COVID. So that is a good thing. Now, the patients have been in the hospital, especially if they fell into the severe COVID category. They have been in the hospital. I think many patients have been there for about 3 months. That is a good 100 days, 90 to 100 days. But at the end of it, to see them going home, recovering fairly well from COVID, I think that has been a very good thing. Then another good thing from a personal point of view, yes, it has pushed us to the ultimate limits of, should we say, patience, should we say, trying to deal with people who are living alone in the isolation ward, for the obvious reason that no attender can be allowed without a PPE. So that has brought in an introspection in me, so that to know about the good things. So that would be the good parts with respect to the COVID. The bad parts, of course, as is the thing, the death rate, the mortality rate is pretty high. So the bad things have been, there are many people who have lost their lives in their battle against COVID. And I have seen many deaths right in front of my eyes, whether it was emergency or the ICU or in the ward or the ITU as well. So since I started my practice after graduating out of MBBS, so I started working in a rural burn center in the year 2014. So 2014 till 2019, okay, when I passed out from my MD in internal medicine, the number of deaths that I had seen over the last 6 years is literally equivalent to the number of deaths that I've seen over the last 1.5 years because of COVID. Means the situation is that bad. Okay, so that is a bad part with respect to it. And from the patient's point of view, yes, of course, it is very difficult for a patient who is going through a lot of sufferings at physical, mental, emotional, social, psychological aspect of it, to be alone in a COVID ward. Especially, it's not like a 2-3 day disease, right? Even if it is mild COVID, generally the patients tend to be in the hospital for about 5 days to 7 days. Severe COVID can go up to 3 months. I've had patients who have been in the hospital for 5 months, literally 5 months in different points, different sections of the hospital. Ward, ITU, ICU, get back to the ITU, worsen, go to ICU, go to ward. It is very difficult. So from the patient's point of view, yes, it has made me and all of my colleagues also understand that there are a lot of support system which is required, whether it be family, friends, colleagues from different points of care from different institutions. Yeah, that would be and the bad thing here being the patients suffer. Patients suffer because of that. So that bad component has been converted to a good component in that we have become a bit more patient in understanding the patient's needs that way to whatever extent is possible. See, we may have a lot of patients. There was a time when St. John's was catering to 1,200 COVID patients. So it may not be possible for us to, sit with the patient 24 hours, but at a doctor's level, at a nurse's level, at a helper's level, whatever can be done, yes, Johns has stepped up to it. So the bad point of COVID, bad point from the patient's point of it has been turned into something like a silver lining has been seen. And that is very important for the recovery. Probably the recovery rate has been very good in Johns because of that. That could be one of the things. Ugly component here would be, non-availability of beds. There was a condition, there was a time in the first wave and the second wave when there are a lot of patients, the number of positive patients have been exponentially, every day it was just going up by leaps and bounds. And naturally there were no beds, whether it be ward beds or ICU beds. So there were many patients who were, it was out in the open, it was out in the newspapers. Many patients were literally dying, sorry to use a word, like dogs on the roads, with lack of oxygen, with lack of so many things. So that was definitely an ugly component of it. And of late, I think I have to add this, violence on doctors is also a very ugly component of the COVID related treatment and management part of it. I hope that people also understand that it is difficult for them, but it is probably even more difficult for us, because we are also doing the same thing that they are doing, that is living away from the family, going away from our loved ones. In addition to that, of course, we are keeping our mental, physical, and emotional, things at bay, and often stretching it to, double duties or triple duties or whatever it is in COVID wards. So yeah, I think that would kind of sum it up: the good, the bad, and the ugly. Yeah.
Yeah, absolutely. That's a great way to put it across, all the different sides and perspectives of the effects of the pandemic. You briefly mentioned some of the challenges that you faced. As we recover from the second wave, what were some challenges that you expected to kind of re-experience after the first wave, and what were some new challenges that you probably did not expect but had to adapt and learn to?
Yeah. So the thing about COVID is, we do not, though it has been 1.5 years, we still do not know much about it, or whatever we know about it is probably just 2%. A lot of researches, a lot of studies are going on. So when compared to the first wave, actually, to be on the right sense, maybe on a lighter note, but on a more serious note, not the lighter note, the second wave was actually not a wave, it was a tide. It was leaps and bounds more than the first wave. Going by the way in which it is, if COVID appropriate behavior is not followed by the public, I'm pretty sure the third wave will not be a wave, it will not be a tide, it will be a tsunami. It will be that bad, it will be a tsunami. So the first wave, naturally, it was a disaster, it was a pandemic, so none of us were prepared for it. The healthcare workers all over the world, the people, the governments, the scientists, whoever, none of us were prepared for it. After the first wave ended, the second wave we knew was kind of inevitable with all the strains, mutations that were going around, UK, US, European countries suffering. It was almost inevitable that the second wave would have come in. The question was when. It just came in. So the thing that could have been done is we could have urged the people to follow the COVID appropriate behavior more stringently. Probably second wave could have been tackled better with that. That is one thing. We were expecting the same complications, the mortality rates, the death rates, and whatever the issues that people had faced, but we didn't expect the numbers to be much higher. That is why I use the word tide when compared to a wave. Naturally, the second wave, the numbers were very bad, very, very, very bad. Vaccination had started sometime in the month of January 2021. So in the first wave, though all the spheres of, all the age groups of people were affected, what I had seen personally, from my own patients here is the death was more towards maybe 60 plus, the elderly people, Then the government started offering the vaccines to the frontline workers and the 45 plus, 60 plus worker, 60 plus age people. Probably 60 plus age people were vaccinated at least with the first dose. So when the second wave came in by March 2021, we saw that the mortality rates were much higher. The numbers getting infected were much higher. The mortality rates were much higher. And it was more of younger people who were affected. Younger people as in 40s, 30s, even 20s, elderly as well, but the proportion was relatively more for the younger people. So that is something that we didn't expect much when we were going into the second wave, but when second wave came in, of course, that was the thing. The second major, should I say, issue or second major medical issue which we faced during the second wave, I think it was all in the newspapers, of course. Lack of oxygen, that was one thing, which was not there during the first wave. Of course, the numbers going high, the demand went up, so the supply was relatively there. That is one thing. And second thing, the complications, the black fungus, what we call as mucormycosis, that was very, very rampant in the second wave. First wave, we didn't really hear of it, but second wave, there were a lot of cases. And now, of course, avascular necrosis of femur, what we call as a bone death or the bone disease, that is coming up in Maharashtra, but probably if we are not vigilant about it, maybe it will be something like a surge of cases as we saw with respect to the black fungus, which can come up. So this was something which we were not expecting, which we were not expecting as in we had seen mucormycosis, that is as black fungus cases even in the pre-COVID era. But the number of cases that had come up almost to the extent that the drug, that is a medication, the treatment to be given called amphotericin was not available. It was so that the numbers went on to such an extent that the treatment drug or the medication was not available. And of course, the beds were not available. And these patients are generally sick. So ICU beds not available, ward beds not available. So that was something which we were not expecting. Okay, so that is a second thing. Otherwise, we had kind of a view, maybe a bird's eye view at least, of what COVID is. So what has to be given, how the patients worsen, when to refer the patient. So that way we were prepared, but these two were the things with which we were generally not prepared. So that is what I would want to talk about.
Yeah, and I'm sure that over the past few years, over the past 1.5 years, and especially with the second wave, it must have really impacted you as well as your colleagues, both physically, mentally, and emotionally as well. On a personal level, what were some of the coping measures that you adopted to kind of distract yourself from that weight and that burden?
Yeah, so yeah, rightly said. It just has, it has affected all the people. It has affected, the general public. Yes, it has affected the healthcare workers also. For the point already made, we are of course staying away from our families. We are staying away. Intentionally, we have not been going. On a personal note, I have not visited my family for the last almost 1.5 years. My parents stay in Kerala, Ernakulam district of Kerala. For the fear of, contracting or being a source of transferring the virus, if at all. Though I have never been COVID positive, I have been taking all the strict measures, but then you have that tiny little thing in your brain because this is there everywhere now. It is there in the atmosphere. Literally, it's like you are married to COVID. It's almost something like that. Like it is there with you always. So because of that tiny thing that comes in your mind, and as a doctor, I know my grandmother has a lot of risk factors for this. So even in my the faintest, I shouldn't even have the faintest of doubt that she should. If she turns positive and I had to visit her, probably I would be the reason who would have, given her that particular thing. So there are many people. The point I'm trying to bring about here is there are many healthcare workers, not just the doctors, nurses, paramedical staff, all the frontline healthcare workers who have deliberately stayed out of the family. Many of them, I know many of my colleagues who have literally changed, bought a new, took a new apartment or taken a new flat just so that the risk population, maybe their wives were pregnant or their parents are elderly, more than 60 years of age, so that they do not expose in any way their family members. So we have gone to such an extent. I stay in a single room here. That's another thing. I stay on the campus. There are many people who have done that, who have moved away from their families. That's one thing. So the coping mechanisms are of course different for different people. And the thing is, it's not just at the physical level, it's more at the mental and the emotional level that the coping mechanisms are to be taken care of. On a personal level, I'm a person who believes in spirituality. I'm a person who believes in, God's power, God's healing. So I just pray. Prayer has been the maximum and I would say the utmost coping strength that I've had. I'm a believer. I pray the rosary. I'm a Roman Catholic, I'm a devout Christian. So that way I pray the rosary, I pray to Mother Mary, I read the Bible every day. So that has been my coping mechanism all throughout. And of course, when you have taken the Hippocratic oath and you have to be dedicated to the patient care to whatever extent possible. Now, there are many things which are not in our hands. I mean, there are many things which maybe government has to bring about some policies about over which I don't have direct power as a individual, probably. So whatever extent, to whatever extent we can take care of the patient for the holistic healing, that is what is called health at the end of the day. Yeah. So that we can impart into the patient only when we accept the fact that COVID is going to be there with us for, let's say, 2-3 another maybe 2 years, another 2 years. So the coping mechanisms primarily has been prayer, and of course talking to my own colleagues. There are a lot of issues that will come up with respect to medicines not being available, with respect to the patients dying unexpectedly, with respect to the patients worsening. Attenders putting in some questions as to why this is not available, that is not available, and things like that. So always talking to the colleagues, talking to my own people from different departments of the hospital, my own department of the hospital, sharing our, whims and fancies in one way, and trials and tribulations and our own experience, which we have had over the last 1.5 years. I think that is something that has really helped us a lot. Yeah. So that would be the coping. So for me, it was all about, prayer, being in solitude, getting the divine providence, and that divine providence to be dealt with the grace to my hands. I think that's what the only thing that I can do.
That's great to hear. And again, you briefly mentioned this, but I would like to ask you, how did the entire pandemic impact your mental health, compared between the last year and this year? Would you say that you were better prepared during the second wave? Were you better adapted to handle the situation, or did it have the similar effects?
Okay. So the mental health wise, I mean, on a personal note, I'm a person who I would say I have kind of a very bad temper. So so that way I'm something like obsessions with one particular thing with respect to patient care. So if I want something to be done, I will get it done, or I will make the people who are under me to get the things done. I'm that sort of a person in general, a type A personality sort. So with respect to the mental attribution of COVID, preparation wise, we knew second wave would come in. We knew we had to deal with it, deal with the wave as such. We deal with the people and deal with the attenders also. So that, and of course, a lot of trials. I already told about the black fungus, I mean, the mucormycosis, oxygen scarcity, ICU beds not being available, ward beds not being available. All this is there in first wave also, but it was just about exponentially amplified in the second wave. So one thing which I realized is, yes, physically, of course, 6 hours in PP is something that will be literally like you're in a furnace, you're in Hitler's, gas chambers, literally almost like that. So maybe worse than that, because you have a patient under you and you have to apply all your brains to, get all the things there, in addition to the physical exhaustion in summer. Yeah. Not just in summer, even otherwise, being in PP is that. So one thing which I realized personally was, if you can have your mind under control, which is of course not easily possible, at least you know what to expect, or you have to just keep prepared for the worst. That's the thing. Be prepared to handle the worst. That's why in the disaster management protocol, everyone talks about disaster preparedness. So the first attack or the first wave with respect to COVID, none of us knew that it would have been a disaster. I mean, pandemic disaster that way. So once this first wave went off, the disaster preparedness, if we had taken it a bit more seriously from, all aspects, individual people to the government part of it, if we had taken it a bit more seriously by making people follow the COVID appropriate behavior and taking steps to, probably curb the transmission of COVID, probably the second wave wouldn't have been a time. But then there are many things, as I said, which are not directly under our control. So the best thing would be to know what you have control with, and to the best of your abilities, to the best of whatever you can do for the well-being of the patient, do it, whether it is at your level and to whatever extent you can help from others level. I can't directly go and talk to government to provide the drugs, but then there are some channels for it. Yeah. So whatever extent you can help, you help. But then the end point may not always be in your favor. It may take time, but at the end of the day, keep your mind under control. Keep your, it's very difficult, though we say mind has its own thing and things like that. Once you know that you have come in to help the patient, and you have the particular thing of making the patient go away as in not somewhere else, but to his home, not somewhere else. Okay. So with that particular thing, if you come in, I guess all the other things with respect to exhaustion or trials or tribulations or whatever you have, everything just goes off, because the sight of one particular patient recovering and leaving the hospital with, after recovery from COVID is something which we have been yearning to see, which we have seen of late, and hopefully it will continue in the whatever tsunamis or waves to come, I guess. So that is one thing which I want to say.
Yeah, absolutely. I mean, prevention is better than cure. And I think that statement applies all the more during these times, for medicals, for the general public, and more so. And we've been listening in the news about the Delta variant of COVID-19, which is supposed to be the latest variant, and it's supposed to be even more easily transmissible when compared to the existing variants. Because of all these factors, how likely is a third wave here in India? And you briefly went over it, saying it'll be a tsunami, but what else can we expect on the in terms of the burden on the medical professionals, and in terms of generally for the common people?
Okay, with respect to, talking a bit of medical point of it here, COVID is basically coronavirus. So coronavirus is a type of virus or a group of virus which can undergo a lot of mutations. So it can change its own structures by, the mechanisms which we refer to as antigenic drift and antigenic shift. Anyway, the thing being, it can change its strain. So that's the reason why we have a lot of strains coming up. The first wave strain was not the same as the second wave strain. So going by the way in which it has been going, and going by the fact that already, third wave, and for that matter, maybe fourth wave has come in now, UK, US, and, the Delta variant has come in, Maharashtra already has started seeing a spike of cases. So I think we should just consider that third wave is inevitable. But when the third wave would strike us, we cannot be fully sure, but going by the general trend, it could be maybe in the next 1 month, 1 to 1.5 months. So whether we'll be in for a lot of surprises, well, we do not know. Only COVID will know that. So because we already had a fair share of surprises with the second wave, I hope that the second wave, which was a tide, was not a prelogue to the tsunami that is going to come now. Hopefully, as you said, the prevention being better than cure, especially in this particular disease where there is no cure. We say oxygen, we say steroids, but that is called supportory. We do not have a cure as such. And there are so many questions with respect to COVID, which is still being unanswered. It can cause anything, starting from heart attack to tiredness or death or whatever it is. Anything and everything in medicine is being related to COVID now. One of the positive agents is that. So what to expect? Frankly speaking, I do not know. If we follow the COVID appropriate behaviors, probably the third wave may not be as worse as the second wave. But again, a lot of it actually depends on the organism itself. How bad, how virulent, that is how dangerous the organism is to affect the body functions. So that is all we can say. We can just think about what all, but ultimately, none of us actually thought that the black fungus would come. Mucormycosis would just go up like that in second wave, but it did. For all we know, maybe some of the disease would just, prop up out of the window sometime with the third wave. And I hope not that happens. Hopefully God, is a bit more merciful to us, and hopefully will mend our ways with respect to our behavior that we have been following late. So, but whatever it is, it's a disaster. It has been a pandemic. So disaster preparedness is something which is the heart and soul of disaster management. So unless COVID appropriate behavior is followed, we cannot, put the blame on anyone. We cannot say, okay, we did this. Ultimately, everyone knows. Most of the people have not followed the appropriate behavior, the COVID appropriate behavior. Government has even agreed to it. That was the reason why there was exponential increase in the second wave. So from our side, whatever is possible, if we can do it, see, whatever has to happen will happen. There's a Murphy's law. Irrespective of whatever it is, it will just happen. So we can probably prevent the damages, and maybe it will not be that bad as what it was in second wave if we do our part as responsible citizens. I think that is what I want.
Absolutely, and I think that's some great advice for the general public, to do our best and try to reduce the effect of this third wave. Finally, a lot of our audience consists of up and coming medicos and professionals like yourself. So, do you have any advice for our viewers on the near future?
Future, yeah. Already I kind of hinted at it with the first point that I made, the good, bad, and the ugly point of it. I think there are a lot of social media things going on with respect to violence with doctors and things like that. Yes, that is there. That is one thing. But the way in which I would like to take it, or I would like to see through it is, yes, it is still a noble profession. And if I have been, see, I don't regret being a doctor. I don't regret having done my 2 years of rural service after my BBS. I don't regret working in the COVID wards, it is because we are here to genuinely help the patient. Naturally, it's beneficence and non-maleficence. That is the core of medical ethics. Okay. So if you cannot do good for the patient, we do no harm. That is a way of putting it. Basically, beneficence, non-maleficence means that. So the medical students, of course, all of them, okay, on a particular note, the teaching is all affected. The medical studies are all affected because of the COVID as such. All of the, medicine is not like the other fields wherein you can have online classes and be done with it. You require a lot of practical exposure. You require patience. You need to be bedside in the wards. You need to talk to the patient, touch the patient, hear the heart sounds or whatever. There are a lot of things. It's all bedside practical medicine, which can never be, replaced by the online teaching. Online teaching is just a part of it. So already, many medical students are with that particular thing that they have not received the so-called, experience or with the so-called teaching, the teaching which used to happen in the pre-COVID eras. But at the end of the day, there are some things that are not in our hands. So we have to make the best possible use or the best possible way of whatever has come upon us. It could be the wrath, it could be whatever, but whatever it is, we have to live in the moment and plan for the future with whatever we have. So all the medical students, interns, have put their own share of helping us, at least in our institution, in my institution, in helping us with COVID. Whether it would be in manning what we have as the COVID war room, or helping with the home quarantine patients and taking care of them, vaccination campaigns. Okay, the medical interns, the people who have passed out their final year MBBS, they themselves work in the COVID ward, putting on the PPE. So all these things are something, when I talk to them, it is a satisfying experience for them. This is something that the world is going through, and they are happy that they could put in a small part of it. I mean, the small part of their effort in for the larger good. Let us put it that way. So COVID is one of the epidemics that has come in. It will be there maybe for another 1.5 to 2 years. It has taught us so many things, at a professional level and at a personal level. Personal level, all these gatherings, the show off and all these things are probably, cut down because of COVID. People have come to know that, they have to live with relatively maybe a lesser threshold of money. Probably they started looking at people with a different wavelength of their mind. The stratification with respect to the rich, the poor, the middle, whatever it is. When there was a scarcity for oxygen, scarcity for getting blood, scarcity for whatever, there was no, rich person, rich strata, poor strata. It's all human beings. I think people have gone back to those humanitarian feelings to some extent, at least because of COVID. But of course, there is a other side of the coin, which is COVID. So there are a lot of things with respect to that, with respect to the disease. So my thing would be, yes, we are into this. So we are doing whatever we can. And for most of us, I think it has been beyond the stretch limit, whatever it is. We will continue to do so. So we'll just keep fighting, because this is what we are for. And I guess we have to serve as an example for the students who are there. And there are many students who actually look up to us. And see, they have done their part, but they see also us doing their part. We are also inside with them in the PPE, not just us as consultants, but even the postgraduates and people like that. So they do, I mean, they are learning the actual, I don't know whether this is a right word to quantify it or to, name it as such, but probably going through the difficult phases of the world right now, seeing everyone stepping in each other's shoes, to whatever extent possible to them. So my only, I won't say it's an advice, it's more of a suggestion. So we'll take it as it goes in. We do not know what is in store as tomorrow. We do not know when we will have a heart attack and die. So live in the moment, make the best possible use of whatever is possible. and let's plan something. It's not like, plans will go just according to whatever, there's no 100% surety or guarantee that the plans would go in. They also say man proposes, God disposes. So there are many people who thought of many things before March 2020, but with COVID, naturally, all of that is gone. No one can go for any vacations anywhere. Many bucket lists, everything is taken off. People cannot have a pompous wedding, sumptuous banquet, things like that. Everything is gone. So just let's live in the moment and make the best possible use of it, so that we are true to ourselves and we can probably make some small, should I say, a positive change in someone else's life. I think that would be a better thing to go about it.
Absolutely, and that's fantastic advice for everyone, including medical professionals. And I think with that, we'll wrap up for today. So thank you so much for your time and for your insights. It was a real pleasure speaking to you, and I wish you all the very best in your line of work. Uh, and to all our viewers, I hope you've enjoyed this interview. Stay tuned for more such inspiring interviews. So make sure you subscribe to the Inflame Medical channel, and we will see you all next time. Goodbye.
Thank you. Thank you, Ayush.